Dr. Dentist, today sharing something that has changed my life and may change yours. Many of you, like I have, experienced back and shoulder, neck, joint pains after years of sitting at the dental chair, trying to see in the patient's mouth and do what we have to do. And now with extra COVID precautions, you may be even worsening your position and postures and positioning for your poor body. Even if you, like I did, learned excellent ergonomic concepts of positioning in dental school, and by the way, look that up on the internet. I was interested to review and realize how much I'd forgotten. And you've tried various dental operator stools, like the most recent one, the bicycle seat style. You know, these things are still, no matter what, you still have a high risk for pain. In fact, studies have shown that the leading cause, maybe I should say, for early retirement is musculoskeletal disorders, pain. Common problems include back, neck, shoulder, wrists, hands, all of it. Early stages of these disorders usually go unnoticed by most dentists, which unfortunately all dental professionals, dentists, hygienists, assistants are all at risk for these disorders, which brings me to what I'm sharing today, because I sure had it. I had the requisite chronic back and neck pain, even at times with my clenching TMJD pain, and then I discovered 2 books, and the information has changed my life. I have no more symptoms of chronic pain or related, none. While this is not to be construed as medical advice, obviously, this information, these books, I recommend you check them out, and soon. If you have chronic back, neck, shoulder, leg, knee, sciatica, joint pains, anything like that, check them out. While this is not to be construed as medical advice, it's still to be construed as excellent advice to look at them. One book is by Dr. John Sarno and the other by Stephen Ozanich, and both of these all about these pains and how to heal them without medical intervention. I know that sounds totally crazy, but truly, get them from Amazon or wherever and read. Let's call it what I thought were normal pain of being a dentist kinds of pains, gone, healed. You see, when I was in nursing, I noticed different personalities were attracted to various fields of medicine and dentistry. For example, let me explain. The personality type that is attracted to dentistry, this is about you and me, is what Dr. Sarno and others call the goodist, the perfectionist, the people pleaser. Why do we have a hard time charging for a redo on an old restoration? Why do we have a hard time telling fees? Why do we go wash our hands when the patient asks that, "Oh, what is this going to cost me, doc?" question, and we just washed a third of the fee down the drain? And why do we keep dealing with third-party carriers who take more than a third of our fees? Why? Because we are people pleasers. Just some thoughts for you. Check the books out. See what you think. You'll see yourself. I already told you what I think.